sense. So, pain relief medication, hormonal contraceptives, which does seem very much at odds given the previous slides about what could be possible causes. That would be including the combined pill, progestin therapy. So progestin therapy is, the medical world would call that progesterone therapy. It's not, and it's really important to make a distinction. Progestin therapy is using a synthetic progesterone. So it would be like the mini pill, it would be the Mirena coil, it would be something like that. Or gonadotropin releasing hormone, which causes a temporary menopause by reducing estrogen. So isn't it interesting that they are noticing that things get better if they reduce estrogen and yet still using the combined pill, which is estrogen and progesterone. Surgical excision, so lesions are removed and many lesions grow back within 5 years. Ablation surgery via laparoscopy, so lasers destroyed with heat or laser, a full hysterectomy and or bowel or bladder surgery. And in some cases, I've got clients who've had full hysterectomy. So ovaries have had to go, uterus has had to go, and they've also had big segments of their bowels removed. And the bit that I really have so much compassion for are the women who have their surgical excision and then they're just waiting. They're like, I just don't want it to come back. I don't want it to come back. And so commonly it does come back. And so in my experience, this is when we need to be working with women to really like, okay, what can we do to support this? Let's nail down your diet. Let's nail down any way that inflammation is being caused in your body. Let's look at all of it to see if we can avoid this, because women have surgery after surgery after surgery. It can be incredibly, incredibly invasive. And the surgery on its own, so even not having a hysterectomy, the surgeries can be so invasive that they on their own can actually cause infertility because of sort of damage to the organs and those kind of things. So the conventional treatments are limited. They're really, really limited. And most of the people I know who experience endometriosis sort of are in those third, fourth sort of stages. They're really scared of it coming back. It becomes very overwhelming. And ultimately, these treatments aren't really dealing with it, because if the excision, if it's going to come back because we haven't stemmed the source, it's like we've got rid of it's like you've got a tap that's overflowing. You've managed to sort of like, get rid of the excess water, but you haven't turned the tap off. So until we figure out how to turn off the body creating inflammation, it is just going to keep coming back. And the thing is that very often people will say, oh, well, they must have left some because I haven't got a uterus anymore, but they must have left some. There must have been some on my bowel somewhere that they just didn't see because it's still growing. And I'm like, yes, isn't that interesting? It's because it's inflammation. It's not a battle against you versus your uterus and your endometrial lining. There is something going on that's causing this inflammation. So that's the real key here. And this is where we can, with some real education, we can really support women to make different choices. And even when we do, probably covering it later, getting any kind of support from the medical model is really hard.
I think one of the confusing things for me is that if a woman is diagnosed with endometriosis and say it's because she's having very heavy bleeds or there's infertility and maybe she's not having pain at that stage, then she goes in for the surgery to have the lesions destroyed with heat or laser. It makes no sense to me that you would go into that area and with heat or with laser and create damage, because there is damage from the surgery, that then can be the immune system is in crisis. So why would you in that area cause more damage for the immune system
to have to heal?
Repair?
Yeah, absolutely.
So this is what we see, is that maybe a woman who has endometriosis, but doesn't have any pain, and then goes in for the surgery to deal with it, and then comes out with pain, and then has more pain, so then goes on pain relief medications or is on the hormonal contraceptives, and then is in more pain, and then goes through more surgeries, and then gets into more pain. And there's this vicious cycle that happens where they feel that the only option is a hysterectomy. And this is heartbreaking for young women who wish to have a family, and end up in this situation where their bodies are broken because of this approach of let's throw artificial hormones at it, or let's throw surgery at an immune system that is in crisis.
I'm not going to lie, being in this job a long time, hear a lot of stories that are really heartbreaking and sometimes hard to hold space for. And that's why we truly believe in doing your own emotional work and having supervision and mentoring and having a way to process as a coach or a therapist. And if I'm honest, these days, it feels like a hatchet job. I'm not saying I actually just feel like the medical model just have a limited option. I think in most cases they're doing the best they can. They just don't have many options. But it's the stories of the women who have had repeated surgery, repeatedly dismissed, just this horrific experience, and then end up with, full hysterectomies or are heading that way. They're the stories that break my heart the most now in clinic. And it's not the individual, it's just because of that feeling of we are not doing enough to help women. There is just not enough. And this response, this conventional treatment, it's usually making the situation worse. And it's all that we've got. So of course, women are going to go down that road. And someone's just put that they're told that pregnancy cured it. Yeah, and that's so interesting, isn't it? Because, progesterone goes up so significantly in pregnancy. That's the interesting piece of the jigsaw that the medical model have been really blinkered about.
And this is where we see the similarities between endometriosis and autoimmune, because also autoimmune can go into remission through pregnancy. And the challenge we have is that when you come out of pregnancy and then you've got the birth experience, and then you've got breastfeeding, and then you've got the sleepless nights and the stress, and your hormones drop off and go crazy, naturally go crazy, we can see endometriosis get so much worse, autoimmune gets so much worse. So it is, again, really, really limited telling a woman to fall pregnant to sort out her endometriosis, because it's just, it's way too short-sighted. And this is another thing that we feel deeply passionate about our role, how we fit into the whole health picture, is by taking this information and educating women on what is happening in their bodies and the choices that they have, so they can reclaim the control. Because there is a real feeling with endometriosis, like you said, I'm just so scared it's going to come back, that you're out of control of your body. And so the more we can empower women, the more that we're going to be taking down the stress. And we know that cortisol plays a huge role in hormone dysfunction and immune dysfunction. This is where we can really, really support women. So, like we said, surgery is often the go-to. However, if there is pain, it is very common that a woman will come out of the surgery and still be in pain. Then maybe the endometriosis has gone because it's been removed with surgery. However, the big question marks women have is, why do I still have the pain then? If the endometriosis has been dealt with through the surgery, why do I still have the pain? And this can often be because the inflammation picture has not been dealt with, which is what we are going to look at as some of the options and solutions that we can offer. It's also, there can be like the structure of the pelvis can be misplaced. And this is where going to see something like a pelvic physio, a woman's physio, a kinesiologist, a good osteopath, someone who is able to work with the uterine structure, the bowel structure, and the pelvic floor to be able to release the stress in that area, this can really help with pain. And there is this connection between the trauma piece. So if there is that emotional trauma that is sat in that place, then our role, we can support women with that trauma, or they can go and see
a trauma specialist.
Absolutely. So it's worth knowing this, if you have a woman who comes to you and is saying, but I've had the surgery and the pain's still there, why? These could be some of the reasons.